We're now going to move into our live discussion section, and we really want to encourage all attendees to be active participants within our live discussion. Please do remember that you can add your comments and views on what we discuss either by using the raised hand function in Teams or by putting your comments in the chat. You are very much the experts in this discussion, and we really want to use this opportunity to hear from and to learn from you. We have a wide range of attendees today, from patients, carers, healthcare professionals and advocacy groups, to name just a few. We really welcome your comments in today's discussion, and we want to ensure that we are able to take on board as wide a range of views as possible. As we move into this live discussion section, the first piece that we're going to focus on is on providing feedback from the discussion that we had in our first workshop in November. If you remember, we recorded that discussion on Teams, and after the workshop, our team here have listened very carefully to that recording to ascertain the main points in relation to the barriers and to the facilitators for improvement to access to palliative care and the introduction of Spark SP in the Colombian context. And what I'm going to do is to talk you through these main points that we lifted out of that discussion in the next two slides. So it would be good to think about, does this represent what we discussed at our last workshop? And are there any important points that you feel we have missed from that discussion? There will be an opportunity after the next two slides to highlight any areas you feel are not represented correctly, or if there's anything you feel we covered in our last discussion that is not included, you can raise it then. So in reflecting on workshop 1 and our discussion within workshop 1, first of all, what I want to do is to summarise the challenges that we discussed at our last workshop. From the recorded discussion, we have created 3 themes around this. And these are challenges in relation to, firstly, healthcare professionals, secondly, in relation to patients, and finally, barriers in relation to financial and administrative issues. Firstly, in relation to the healthcare professionals. So from the discussions, there was a lack of reported knowledge in relation to palliative care, particularly that it should be based on patients' needs, not prognosis, and that we need to help educate that palliative care does not just mean end-of-life care. This was seen as important in relation to integrating the Spark SP tool, as without this education, healthcare professionals may not see the need for introducing the tool. The second issue in relation to healthcare professionals was unfamiliarity with the Spark SP tool. Now, this may not be surprising given that we are just working on validating the Spanish translation of this tool, but to use it, education needs to be given on the development and also the use of this tool. In relation to patients then, the second part of this, the issues in relation to understanding palliative care were similar to healthcare professionals, but we do need to be mindful that education for patients needs to be delivered at a level that they can understand, for example, without using any medical jargon, any medical terminology. In addition, the medium in which we deliver education also needs to be thought through, and in particular, the level of illiteracy common among patients needs to be considered, and a variety of education mediums will need to be provided. Finally, there were financial and administrative barriers noted. These really focused on set amounts of time that were allocated per patient visit, and how we might influence this to integrate Spark SP into meeting. So topics such as multidisciplinary team meetings involving Spark SP within the clinical evaluations of multidisciplinary palliative care groups, and how we might most efficiently use time within clinical meetings. For example, if a health and social care professional is trained in Spark SP and has completed an initial full assessment with Spark SP, could they then use just the headings within Spark SP to ascertain if there are any issues within that domain, and if not, to move on to the next section to optimise time within clinical meetings? There was also a discussion around who uses Spark SP, and could we involve key stakeholders such as healthcare students and palliative care groups in the Spark SP process. We also discussed other forms of the tool, the Spark SP tool, rather than a paper copy, such as its use through audio or through video, and also the potential to send Spark SP to patients prior to appointment so that they can help to identify issues that they want to bring to their meetings. But again, we do have to give consideration to illiteracy rates and how we would deliver Spark SP. So the previous slide that we just looked at focused on challenges, and this slide focuses on opportunities in relation to integrating the Spark SP tool that we discussed at our last stakeholder meeting. So the first opportunity we identified was political commitment to patient-centred care, where palliative care is integrated into that care, and the importance of recognising that as we move forward. One of the other opportunities that was raised is that we have patients and carer attendees at our co-designed workshop meetings. This is really, really important, and their voice is imperative to co-design any implementation strategy for Spark SP. We do need to work very closely with these key stakeholders and to ensure that they actively contribute to the co-design process, so that we recognise and respond to their experiences in relation to palliative care and to learn from them about how we might best integrate the Spark SP tool. One of the other opportunities that was raised is that the Spark SP tool is an opportunity in and of itself to start a conversation starter. But one of the things that we need to think about is, do all healthcare professionals have effective communication skills to facilitate these conversations? Additionally then, there are good examples of palliative care already within Colombia, and we need to think about how we can best profile those and how we can best learn from them so that we can frame the implementation of the Spark SP tool within those contexts. Finally, one of the issues that we talked about was that palliative care, it's not just a medic's job, it's also about nurses and allied healthcare professionals and what their role is in relation to palliative care. And how do we help facilitate this? For example, how do we involve allied healthcare professionals in the holistic needs assessment in palliative care, where the Spark SP tool may fit in? So just taking a moment to pause and reflecting on the previous two slides, there are two main questions that I really want to use the next few minutes to ask of you and to reflect on. So does the information that I've just provided accurately describe what we discussed in our last workshop? And, or is there anything that you feel is missing, something that perhaps you have brought up at our last meeting that you feel we haven't captured within the previous two slides? So we're going to pause the recorded slides here so that we can hear your thoughts. Please do remember that you can contribute your comments either using the raised hand function or to write them in the chat. Please do use whatever language, Spanish or English, you feel most comfortable with. We have both Spanish and English speakers here today as part of our team, and we can translate as we go along, so please use what is most comfortable for you. It's really important that we hear your views. Please do feel free to add them. We very much welcome your comments. As we move forward from our last co-design workshop discussion, what we would like to focus on now is to explore in more depth some of the barriers or the challenges that were highlighted in the workshop 1 discussion. And that's really to learn a little bit more about them and also think through how we might be able to create solutions so that they too can become opportunities. Again, you can contribute your comments using the raised hand function or write your comments in the chat. Again, please do use whatever language you feel most comfortable with. We have both Spanish and English speakers here tonight as part of our team, and we will translate for you as we go along. In this discussion again, what is really important is that we hear your views. Please feel free to add them. We very much welcome all of your comments.